Shall we start the session, ma'am?
Yes.
Yes, ma'am. Humble pranams to the gathering. Welcome you all to this beautiful evening. Let me begin by quoting the inspirational words of Albert Einstein. Life is like riding a bicycle. To keep your balance, you must keep moving. With great joy and immense pleasure, I extend my warm welcome to all the dignitaries, guests, and delegates present here for the Dr. Sudhir Rajan Memorial Free Webinar Series organized by DIKSHA Academy under the banner of Ayurveda Ka Amrit Kal, initiated under the visionary guidance of Indian government. India is marching ahead with a vision of making India a real leader in all aspects. To contribute towards this vision of making traditional medicine more accessible to all during the Amrit Kal, let's become a part of history, marking the golden period of Ayurveda. Today, we are fortunate to have Dr. Merugu Shirisha ma'am with us to discuss on a very interesting topic, Ayurvedic treatment for various gynecological diseases. Dr. Merugu Shirisha is presently working as Associate Professor in the Department of Sri Roga Prasudi Tantra at AL Government Ayurvedic Medical College, Warangal, Telangana State in the Department of Ayush. She is a graduate from the same college from Warangal and she has completed a post-graduation that is MS Ayurveda in Sri Roga Prasudi Tantra from Ashtanga Ayurveda Mahavidyalaya, Pune, Maharashtra. During her studies, she was the university topper and gold medalist. She has presented several research articles in national and international seminars and received Best Paper awards. She has a teaching experience over 15 years. Her area of interest in Ayurveda gynecology is treating infertility, PCOS, and fibroids. With utmost pride and privilege, we welcome you to our platform, ma'am. Before starting the session, I would like to go through few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection first. And if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions can be raised, posted in the chat box. Questions raised will be cleared at the end of the session. Now, without any further ado, we will turn the time over to respected Dr. Merugu Shirisha ma'am to enlighten our minds with her knowledge. Over to you, ma'am.
Thank you, Jinsi. Thank you, Dr. Jinsi.
Thank you.
Very good evening. A very good evening to one and all. And first of all, I sincerely convey my thanks to the DIKSHA platform for the opportunity, and myself, Dr. Shirisha Sridhar Initiative, that is a Shirisha Merugu, working as associate professor. In this presentation, I would like to throw a light on the gynecological diseases based on the Ayurvedic pathology as well as the modern pathology, and what is the treatment advised in different conditions. And at the same time, I'm happy to share few clinical experiences along with the case reports so that the participants who are there in the PG or UG students and the other Ayurvedic practitioners get the confidence in practicing the Ayurveda, and they will practice the gynecological Ayurvedic gynecology practice. They will improve and definitely it will help, I think so. And a few practical cases where the allopathy has not shown the solutions, Ayurveda have given the positive significant results with the success. Okay, so let's move on. Am I audible, Jensi, ma'am?
Yes, ma'am, you are audible, ma'am.
Okay, thank you. As you all know, women is epitome of strength, love, sacrifice, and courage. She's a creator, caretaker of each and every home. Her health is the family health and her sickness is the family sickness. So she has got that much of importance. So the common gynecological problems from menarche to menopause, these are the common symptoms, common diseases will come across in the women life. That is infertility. First, starting with the menarche, dysmenorrhea. Next, infertility, dyspareunia, leucorrhea, dysfunctional uterine bleeding, breast disorders. These are the common gynecological diseases we'll see in a women's life in different stages. Next, first we'll see the infertility. As you all know, the incidence of infertility is increasing in day-to-day life, and the infertility definition has been explained as it is a failure to achieve the conception even after the 1 year of a successful marital life, means unprotected intercoitus by a mature aged couple is called infertility, primary infertility and secondary infertility. And in simply to say, the infertility is the inability of a sexually active non-contracepting couple to achieve pregnancy in 1 year. So this is the definition given, and World Health Organization has defined it as a disease of the reproductive system defined by the failure to achieve a clinical pregnancy after 12 months of regular unprotected sexual intercourse. And the infertility is of two types, primary and secondary infertility. As you know, failure to achieve even one time conception is called the primary infertility, and failure to achieve the conception by the second time is called the secondary infertility. So common causes of the infertility. These are the modern causes. Normally said that the ovarian factors plays about 30 to 40%, whereas the tubal factors 25 to 30%, uterine factors are 10%, and the cervical factors are 5%, and endometrial factors are the 1 to 10%. But all the reasons are explained in Ayurveda in one shloka by Charaka. That is a Yoni Pradoshan Manaso Abhitapascha Shukrastra Gahara Vihara Doshat Akala Yogat Balasangshayacha Garbham Chirad Vindati Saprajati. This is the beautiful shloka explained by the Charaka, in which almost all the causes of the infertility come across. That is, the first is a Yoni Pradosha, which we can say the functional and anatomical defects of the reproductive system. As the uni word can be applied for the entire reproductive system, that is a congenital, acquired, anatomical, functional defects of the uterus, endometrium, cervix, vagina, everything can be included under the uni pradosha. And manaso abhitapascha, that is a psychological imbalance. Here, he has explained that the saumanasyam garbhadharananam, the psychological balance is very essential to attain the conception. So here, the psychological imbalance leads to the hormonal imbalance, that in turn leads to the improper ovulation or the improper growth of endometrium, means imbalanced conditions for the conception. And Shukra Asruka Ahara Vihara Dosha, Shukra doshas, all the sperm disorders or the defects of the sperm, either maybe motility defects or the head defects, normal forms, abnormal forms, etc. All comes under the Shukra doshas, and the Asruk doshas, that is the menstrual irregularities, anovulatory cycle or the ovulatory defects, etc. can be included under the Asruk doshas. And Ahara doshas, the dietetic factors, which are the nutritional factors, which are responsible for the development of the Shukra and Asruk in case of the couple. And Vihara doshas, improper activities, which may aggravate the Tridoshas and leads to the disturbed condition of the ovulation or the menstrual cycles, and leads to the infertility. Akala Yoga, that is the lack of sex education, that is a safe and fertile period. Knowledge is lacking here. That's why. And the Balakshaya, here the Bala can be divided into the Shariraka Bala and Garbhadharana Bala, maybe suffered with the few conditions, few diseased conditions such as tuberculosis, etc., are leading to the infertility because of that the endometrial growth is disturbed and the anovulatory cycles may happen, and because of the tubercular infection, the blockage of the tubes happens, etc. And the Garbhadharana Bala, though everything is there, maybe the psychology is not present, maybe the lack of sex education, and this comes under the Balakshaya, Garbhadharana Bala. The uterus is not permitting or having some defects. Next comes to the Arthavaha Shotas. Arthavahe Tayor Mulam Garbhashayam Arthavahinya Damanya. So Tatra Vidasya Vandhyatvam. It's not it's Vandhyatvam. Maithuna Asikshnita Arthavanasasya is explained by the Sushruta, which can be correlated with the tubal blockage. That is Ardhavaha Shotas, means which carries the ovum. That is the tubes, fallopian tubes, where the avarodha is happening because of Vata, Kapha, Pitta, Sankocha, Shofa, and Paka are happening, and the Shrota Sangha type of obstruction taking place, and the tubal blockage is because of these. Means these may happen in different conditions, various types of infections and PIDs, Aticharana Paripluta Papulata, Yoni Vyapas, etc. These all comes under the, and after that, the Vandya Yonipa Vyapat, which is explained by the Shushruta, is clearly says that the Vandya Nashtarthavam Vidyat. Here the Nashtarthava is itself saying the entire defects of the Arthava. Here, so that is the either menstruation, absence of the menstruation or absence of the ovum, are this word can be applicable. Arthava, the word can be applicable to the ovarian hormones. That's the defects in the ovarian hormones. And in one more conditions, the Basavarajiya explains that the Vandya Dushtarthavam Vidya means here the Arthava get disrupted. Means previously it was good, but later it was disturbed. That condition is, according to Bhava Mishra, it is a Nirarthava. So here if we'll correlate this word, so that the Nashta na ashati means it not exist, means that is a congenital defects, maybe uterine absence or some other conditions, hypoplastic uterus, etc. were seen in, and na pashyati, not seen. Though it's happening, it's not seen. Nashyati, absence of visible arthava. That means previously it was good, but the secondary amenorrhea was existing because of so many reasons. Next, in Vedic terms, if the Vandya is in here two things. That is, the Vandya is a pathological condition, and the Vandya is applied only for the women. And whereas a Vandyatva is a condition which can be physiological, and pathological during a pregnancy or before menarche, after menopause, and during lactation. Whatever the Vandyatva infertile condition is, it's a physiological condition. Whereas a pathological condition is where the some pathological pathology is there which is not permitting the women to get conceived. That is a Vandyatva, and the Vandyatva word is applicable to both male and female. That is a female Vandyatva and Pumvatva and Stri Vandyatva. So the reference of the Vandya means this infertility, especially in the women, is found in the Vedas also. In the Rig Veda, it is explained that the Durnama Krimi, which destroys the Garbhashaya, means which disturbs the Garbhashaya, which leads to the Vandyatva. The women get not conceived. And whereas in Ayurveda, Garbhadharana Vidhi, how to achieve the pregnancy, the total process is explained. In Atharvana Veda, description of the Bija, Virya, Yoni, and Garbhashaya, and the role of these four items, these four parts, is clearly explained in the Atharvana Veda. In Agni Purana, the Garbhadharaka Upacharas are also explained. So, in a Vedic concept also, the Vandya is explained. But here, if we go into deep into the Nashtartava, so that is a complete absence or the destruction. Nashyati, na ashati. Here, the absence is a primary amenorrhea. So no ovulation, no conception. There's a lack of ovarian hormones. Are there? It's a, mainly it can be said as a HPO defects. That is a hypothalamo pituitary ovarian axis defects, and the destruction. Previously it was there, but later because of the diseased conditions or some pathology has happened to that women and it is destroyed. That is either partially destroyed or completely destroyed. That is irregular cycles and defective ovulation and secondary amenorrhea and ovulation. This happens. So normally this high stressless, this can be correlated with the LOR, low ovarian reserves, where the high stress levels, thyroid dysfunctions, either weight gain, either too much weight gain, or weight loss too much, or over exercise, aging, and other habits like smoking, drinking, etc. And in the patient, which leads to the POF, that is a premature ovarian failure, where the patient cannot get conceived. And other things, the Vandya, Nashtartava with the, I told you the HPO functional defects and hypothalamogonadism and congenital defects and structural defects in the reproductive system is can be taken along with the chromosomal defects. Whereas secondary amenorrhea, as I told you just now, surgical expiration, anorexia nervosa, weight loss, radiotherapy means she has undergone for hyperprolactinemia conditions where the secondary amenorrhea exists and premature menopause in the women is seen. So next, so what happens in this Vandya Yoni Vyapa? That is Ahita Ahar Vihana Sevan, the aggravated Vata reaches Artha Vaha Shrotas, are in terms other we can say that the reaching the reproductive organs and causes the vitiation of the dhatus, upadhatus there, and bijopagatas happens, and which leads to the anovulation and defective ovulation leads to the Vandya. Here the Artha Vaha Shrota gets avarodas and Artha Vanasha happens and Vandyatva is seen in the patient. Next, so this is also like the same obstructive flow of the Ardava, which leads to the Nashtardava. Next is the Bandhya Garbham Gruhnatina Brusham. So this is the failure to achieve the conception according to the Harita. And in Balyavastha, the physiological Vandyatva is existed. This is explained by the Harita Samhita, and according to him, these are the types of the Vandya. He has told that the Kaka Vandya, one time conception has happened, but the second time she is unable to conceive, Anapati, not at all conceived, and Garbhasravi, recurrent abortions, habitual abortion, Mrutavasya, stillbirths, and Dhatukshya due to the formation defects of the Dhatus. Means the Dhatus are depleted. That's why the proper ovulation and etc. means ovarian hormones are not properly happen, and injury to the uterine or the reproductive organs, that is a Garbhakosha Bhanga. And according to Ashta dosha, this is Ashta three doshas. Among that, he has explained the Vata, Pitta, Kapha, Rakta, Sanupita, and Abhicharaja, Daivaja, and Graha Prakopa. And 4 types of the Vandya is told in the Ashta dosha. That is the Janma Vandya, means who has the congenital defects, and Mruta Vandya. She is having the stillbirth continuously, Kaka Vandya, secondary infertility, and Kadali Vandya, unable to conceive. Next is the Bandhya Kalpadruma. In that book, it is explained the 8 types of the Vandya, that is the Janma, Kaka, Mruta, and Sarvet Garbha, and Muda Garbha, Rajohina, Kanya Prasuta, and Galagarbha. These are the commonly explained. And according to Madhavakara and Rasaratna Samocha, 9 types of the Vandya is explained, that is the Vata, Pitta, Kapha, Sanipataja, Raktaja, Adi, Daivaja, Abhicharaja, and Bhutaja. Next, as you all know, the reasons, the causative factors of the Vandya Yoni Vyapat, and along the common Yoni Vyapats, that is the Midyapcharena Strinam Pradushtina Arthavinaja, Jayante Bija Doshasta, Daivasha Shumita Praka, that is a 40 lifestyles, habits vitiated the menstrual blood, are the defects in the ovum is formed, are the hereditary or the congenital defects, and because of the Daiva, destiny. And in the Ayurveda, it is explained that the defects in the ovum is possible when the baby is inside. That is here the Yadahasya Shonito Garbhasya Bija Bhaga Pradosha Mapadyate Tada Vandyam Janayati. How she is born, when the defects in the bija itself happens, then the Vandya is generated. That is a Mata Pitru Sambhavani Rajasta Shukram Cha Vandati Garpe. Apyayate Shukram Astrukna Bhutani Rasod Bhavani. So here the bija Bhaga Vikruti. So the part of the bija which is responsible for the formation of the Garbhashaya and the entire reproductive system of a female baby got defected. Then the baby who is coming into the world have the defect in her reproductive system itself, that is the Avyava Vikruti, leads to the Arthava Garbhashaya or Utpadaka Bhaga defect, which leads to the development of the uterus defect or the ovum defect or the menstruation defect, which in turn results in the formation of the Vandya. Next is the tubal blockage. Is in the primary infertility is found 16 to 20%, whereas the secondary infertility is found 25 to 30%. Common modern causes of the tubal blockage are, as just now we have seen that the Ayurvedic causes of the tubal blockage, Vata, Pitta, Kapha has get the Shofa, Sankocha, and etc. and causing the tubal blockage. And these are the modern causes, that is the PIDs, STDs, congenital abnormalities, and post-abortive, post-puerperial infections, which leads to the tubal blockage. And previous tubal surgeries are the tubal endometriosis and TB infections, spam, and the torch infections, etc. Next, complications. So because of this one, these all cases, the Shukram is not accepted by the Yoni, so which leads to the Vandyatva. Here the Vandya is, its infertility is explained as explained in the Vata Vyadhi Samanya Lakshan. When the Vata gets aggravated, the Vandyatva happens. This is the common explanation while describing the Vata Vyadhi Samanya Lakshan. The Vandya is explained in that. Here the Garbha Shukra Rajo Nashaha Spandanam Gatra Satsata. While explaining the Samanya Lakshan of Vata, Garbha Shukra Rajo Nashaha, he has said Garbha is destroyed, Rajo is destroyed. Here either it's a defect, means the destruction of the menstruation or the ovum or the ovarian hormones takes place when the Vata gets aggravated. So in that cases, Yoni Shuddha, only the semen is accepted by the Shuddha Yoni. So this is the treatment. Chikitsa Vidhan explained by the Ayurveda, Snehan Svedan Vaman Virech Asthapan Anuvasana Kramashah Upacharet. So these are the normal treatment, line of treatment should be offered in the Bandhya cases. So Artava, Doshara, whatever that means, the irregular menstrual cycles, that should be corrected. As you know, when a patient comes, the infertility patient comes, they will be in a depressed condition, and whenever the patient gets the period, simply we can see the silent weeping of the uterus in her face, because as she got the cycle, she is not conceived. The silent weeping of the uterus, we can see her on her face. So first we have to correct the menstrual cycle, then we have to induce the ovulation, and then we should give the treatment for the conception. This is the line of treatment practically applicable to the infertility couple. So here the Nidana, Parivarjana, Yoni, Vyapna, whatever the pathological condition is existing should be treated. Then Prajasthapana drugs helps, and Bijotpadaka Chikitsa, ovulation inducing should be done. These are the Prajasthapana drugs commonly explained in the Charaka. That is a Aindri Brahmi Shataveda Sahasravira, Moga Avihada Shivarishta, Vatya Pushvi Ishvaksena Kanta. These are the Shaimanani Prajasthapanani Pananti. And according to the Bela, he explains that the Niruha Basti acts as a nectar for this. And Basti Karmani Hyod. Basti is the best treatment, which is like a nectar for all the infertility couple. These all explained by Bela Samhita. And this is the Anuvasana Vasti, especially given in the Nashta Pushpa and Alpa Pushpa cases, and Shatapushpa Daila Vasti. And its Nasya is given in the irregular menstrual cycles, and etc. These are the oral medication can be given. Next. So here the defects means where the Basti is increased, where the Vata is increased, that leads to the infertility condition. The predominant dosha is the Vata. First to treat the Vata in all the infertility couple with the Basti Krama. Then as the regulation of the Vata happens, there are the more chances of the conception. As this is the importance of the Vata, because Apana Vata, it plays very important role in the ovulation, because the Shukra Artava Shakramata Garbha Nishkramana Kriya is a function of the Vata. Whatever may be, the Apana Vata plays very important role, not only while during the intercourse, the Vata aggravated and the Pitta aggravated liquefies it and reaches the ovum, and the ovulation happens with the rupture of the micro muscles and the traveling of the ovum. These all are done by the Vata. And whenever the sperm reaches the tube and reaches the ovum and the conception happens, but the next second it is termed as a garbha, and that garbha which is formed in the tube should be brought into the uterine cavity and it should be implanted. That is the traveling of that garbha from the tube to reach the uterine cavity into the endometrium implantation. That is that whatever may be, the traveling is the complete function of the Vata which happens. The ciliary movements, etc., whatever are there, that garbha which is traveled, garbha nishkramana from the tube to reach the cavity of the uterus and implanted in the endometrium is a function of the Vata. So here, whenever the Vata gets deviated or disturbed, here the disturbance of reaching into the, or the formation of the Garbha, or the specimen reaching into the ovum, etc., all the functions are because of Vata. When the Vata gets deviated, these all, any of them or all of them may be disturbed and the pregnancy will not happen. Next, these are the common medications which I use in my clinic. These are depending upon the condition of the patient and depending upon the psychological condition as well as functional condition and pathological condition of the patient. These drugs are given. Later, when I'll explain about the cases, when I'll share the clinical cases, I'll tell you. Next is the primary dysmenorrhea condition. This is the commonly the women is suffers after menarche. The women complains of this. That is a dysmenorrhea. That is a painful menstruation where the pain is in such a magnitude which incapacitate the women in her day-to-day activities. It not only disturbs her physical activities, but also it shows its impact on her psychology also. So this may be due to many causes. And the primary dysmenorrhea, it is two types, primary dysmenorrhea and the secondary dysmenorrhea. And the primary dysmenorrhea, which is not associated with any pelvic pathology, and it is seen in the commonly adolescent girls, unmarried girls, commonly it is seen. And the causes mainly are the psychosomatic factor and narrow introitus and role of prostaglandins, that is the increased vasopressin during the menstrual cycles increases the prostaglandins, which in turn increases the myometrial hyperactivity, which in turn results in the dysmenorrhea. Imperforate hymen, here the imperforate hymen where the secretions should come out through that, but here as it is an imperforate hymen, the secretions are pent up inside of it, and every month the menstruation is happening, but it is not discharged after because of imperforate hymen. So whenever the every month the patient explains that the same time she is getting the all the symptoms of menstrual cycle, but the menstrual flow is not coming out. That you can as you examine the pent up, the accumulation of the secretions inside the uterine cavity, and it may be drained into, it may come and settle into the accumulated inside the vagina, that is a hematogalps. When it is accumulated inside the uterine cavity, it is the hematometra. When it reaches into the tubes, it becomes the hematosalpinx, etc. So a tense bag, you can see the bluish discoloration when you will examine inside the vagina. So it is a surgical case, that where you have to make a cross cruciate incision should be taken, and the solutions, the accumulated fluid should be drained out. So this is the surgical case. Next is the congenital malformations of the uterus, where so many congenital, either infusion of the defects in the fusion of the Mullerian ducts, or recanalization, or formation of the didelphus uterus, bicornuate uterus, bicornuate bicolis, etc. All the congenital formations, malformations of the uterus, which leads to the improper growth of endometrium, unbalanced uterine myometrial hyperactivity because of prostaglandins are more secreted. So these are causes the excessive pain, that is a dysmenorrhea condition. And Udavartini yoni vapath, and in the Vataja, Antarmukhi yoni vapath, that is a retroverted uterus, and these all conditions, normally the patient complains of the severe pain. And this pain we can't say that the patient is having a much pain, because the pain is does not have any measurement. It's a perception. If the woman is having a pravara, satvika prakriti, she says, I'm having a little pain, though the pain is much. And whereas the avara prakriti women says she's having a much pain with a little mild pain also. So it can be measured with a VAS scale, visual analogous scale. So it's a perception. So history should be taken properly. In the family history, is there any history of primary dysmenorrhea, her mother, etc. Complete history should be taken, and the examination should be done. Coming on to the secondary dysmenorrhea, normally the primary dysmenorrhea, the pain after starting of the menstruation, within the 3 to 6 hours, the pain gets relieved. And with a good sleep and with the hot water bath fermentation, the pain gets relieved, because there is no pelvic pathology, specific pelvic pathology is not there. So nothing to worry. Next is the secondary dysmenorrhea. The secondary dysmenorrhea commonly seen in the above aged, 25 above, 30, 35, 40, up to that. Because the secondary dysmenorrhea is associated with the pelvic pathology. There is a specific pelvic pathology. This is also called as a congestive dysmenorrhea. The pathology may be varying. With that, the symptoms are varying. Whereas a primary dysmenorrhea, the pain automatically relieves after 3 to 6 hours. Whereas this secondary dysmenorrhea, pain is uncertain. It may be in the middle of the cycle or before the 1 week of menstruation starts, and it may be varying with the degree, depends upon the pathology which is existing inside the pelvic pathology, which is present, depends upon that the symptoms varies in the women. That is a common pathological conditions causing the secondary dysmenorrhea are the adenomyosis, pelvic masses, and post-surgical growth in the uterus, fibroids, polyps, etc., endometriosis and endometritis, Adenomyosis is nothing but the growth of endometrium into the myometrium, and endometriosis is the growth of endometrium other than the uterine cavity. So these are the common pathological. So many are there. Even in the ovarian cysts also, the secondary dysmenorrhea is experienced by the patients. So different pathological conditions shows the different symptoms in secondary dysmenorrhea cases. So the primary dysmenorrhea normally we can correlate with the Udhavartini Yoni Vyapat, where Sir Ugartha Rajaha Krushtrinodavritam Arthavi Savimuktete Takshinam Labate Sukham. That is, whenever the discharge happens, the woman gets, the girl feels some sort of lightness in the pain. So this is the explanation given by the Cherka. Next, so how to manage the dysmenorrhea cases? That is a first psychological counseling, assurance, rest, and healthy diet should be advised, and the oral medication Chandra Prabhavati, Dashamula Kashayam, Dashamula Arishta. It's experienced that the Chandra Prabhavati and Dashamula Arishta, whenever given in the first 3 cycles, automatically the patient gets a good relief of that. Apart from that, the patient is advised to take the 3 days prior to the cycle. 3 days prior to the cycle, the Ajamoda Kashaya prepare at home and drink it, which gives a very good result in the dysmenorrhea condition, especially in the primary dysmenorrhea condition. Kanchanara Gugulu and in Yogaraj Guglu, as it is considered that the pelvic tissues gets edematous, that's why the pain is arised here. So to relieve that, so Dashamul Kashayama Shodhahara Chandra Prabhavati, to relieve the edemas is advised to the patients Shankavati, Hingvadivati, which is a Shulahara drug. So it is advised to the patient, and local fermentation, Vatantak Taila application or the Nirgundi Taila application is given. Wherever the in conditions of the primary where the narrow introitus, etc. are there, in such a cases the Yoni Davana and Balataila Pichu, the Yoni Davana with the Dashmul Kashaya or the Panchavalkal Kashaya and Pichu with the Balataila has shown the very good results. And if the patient is got married, already she's married, then Uttarvasti is advisable to the patient. Or Yogavasti Krama, where in secondary and the primary dysmenorrhea, the Yogavasti shows a better result with the Vatahara Thailas is used, and the Dashmula Kashaya or the Maharasnadi Kashaya is employed in the Yogavasti Krama, gives a very good result. Next. This is the dyspareunia. Dyspareunia is nothing but the painful coitus that because of many reasons, maybe the psychological rigidity or the narrow introitus or the inflammatory conditions, obstructions in the vaginal path, and yoni vyapas such as Vipluta Nitya Vedanam, Paripluta, Antarmugi, retroverted uterus, and the Shushka yoni, that atrophic vaginitis, etc. In these all conditions, the dyspareunia is experienced by the women. Not only this, some other pathological conditions, that's the extra growths in the vagina, and ovarian cysts and pelvic inflammatory diseased conditions, and cervical erosions, etc. In all those cases also, the patient experiences the dyspareunia. In such a cases, the psychological condition, psychological first test her psychological condition, and then give counseling to her and educate her about the sex education, and general health promoters. Some nutritional diet is advised to the patient, and the oral medication to anti-inflammatory Kanchana Ragugul, Yogaraj Gugul, Chandra Prabhavati, Dashamula Arishta is advised, and Yoni Davana with the Bala Kashayam helps very good, results very good. If it is not available, you can go with the Trifala Kashayam and Panchavalkala Kashayam, and Pichu with the Jatyadi Taila, Bala Taila. Results gives very good result in the dyspareunia condition. And the whatever the pathology is underlying, means the cervicitis or the cervical erosion and other PID cases, those should be treated along with these oral medications. The local treatment should be given to the patient. And Basti helps very good, especially the Matra Vasti with the Dhanvantaram Thailam and Mahanarayana Thailam or the Sahasharadi Thailam. Anuvasan Basti helps very good. And Kshirabala Thaila also gives a very good result if it is used for the Uttar Basti. Next is the Leucorrhoea. This is the commonest condition, can be seen in all stages of the all the life stages of the women. In many of the patients, regularly in day-to-day practice, will come across these type of cases, nearly 10 to 20 per day in good practice. So, as you know, the leucorrhea, the Shweta Pradhara word is told by the Bhava Mishra, and this leucorrhea, it's a natural defense mechanism which is present in the vagina. That itself, the dodderline bacilli, which is present in the vaginal mucosa, continuously converts the glycogen into the lactic acid and maintains the pH as a 4.2 to 4.5, which is a natural resistance and natural defense mechanism of the vagina, where the organisms cannot grow and no infection has happened. But in day-to-day practice, whenever after the menstruation, it's wipes off and the pH may alter, or during the mid-cycle, the pH may alter. So the alteration of the pH leads to the invitation for the secondary organisms, where these are the common organisms. The first two organisms are commonly seen in the practice, that is the Trichomonas vaginitis and the Candidiosis. These two organisms commonly we will see. So here 25 to 35% patients are come with this type of infection, that is a Trichomonas vaginalis, which is anaerobe, it's a protozoan, and common mode of transmission is a usage of common toilets and unhygienic articles and unsterile utilities, means innerwears which are unsterilely used, and sexual contact. These are the common mode of transmission, and unsterile articles usage. So the clinical features are the profuse offensive excessive discharge and greenish yellow, frothy in nature, varying degrees of itching. Means it may present or may not present, but sometimes it presents. Inflamed vaginal walls and punctate hemorrhages are seen. If it should be treated when it is in the vagina only. If it is not, if it ascends and reaches the cervix and causes the punctate hemorrhages spots on the cervix. The cervix is reddened and looks like a strawberry, and strawberry cervix is a sign of a chronic Trichomonas vaginalis infection. So this organism is able to survive above 6 pH. So whenever it, most of the times it is seen in the post-menstrual conditions. So examine it, and as you collect the swab and if you will examine the flagellated organism, you can check under the microscope. So this is a common treatment is employed, that is a Pushyanga Churna, the Chandraprabhavati and Kanchanara Gugulu, and Patrangasava, Lodrasava can be given. And local treatment plays very important role. As we alter the pH, when we'll reduce the pH and bring it in between the 4.2 to 4.5, it creates a static media and stops the growth of the Trichomonas vaginalis, especially that should be bring in between 4.2 to 4.5. So you can use the Triphala Kashayam, Amalki Kashayam, and Palasha Kvad, Panchavalkala Kvad. Especially the Triphala Kashaya gives very good results and alters the pH and provides the static media and stops the growth of the Trichomonas vaginalis. If it is reached the cervix and caused the cervicitis and the punctate hemorrhage, strawberry cervix, then it should be treated as a wound-like. And first you apply Pichu with the Vranashodhana Thaila helps, and the unhealthy tissue is sloughed off. After that, the wound healing oil is applied. Chatyaya Thaila, Amalki Thaila, Chincha Thaila, whatever may be, you can use and as a Pichu. And the application of the Haridra Amalki Gruta is also helps. Next is a Leucorrhoea. The other organism which come across is the Candida albicans. It's a fungus, and this is seen in the about 35% of all Leucorrhoea cases, and the mode of transmission is same: sexual contact, usage of continuous sitting, which increased sweating, which provides a wetness where the fungus can easily grow, and unhygienic articles usage, and sharing the articles, and one more, usage of common toilets, etc., and unsterile intents using. These all causes the organism to transmit and organism to infect the vaginal mucosa. So this Here the important symptom is intensive itching. And so here the pruritus is intensive itching is seen, and the swollen redness of the vulva is, and the discharge is a white thick curdy discharge in the form of flakes is seen. When you will examine with perspeculum, you will find the flakes got a cheese type appearance on the mucosa. You will see if it is not treated, these all infections when not treated, they not only inflames the vagina, reaches the cervix, and then reaches the pelvis and causes the pelvic inflammatory diseases. And one more thing, these adjacent to the vaginal orifice, there is a urethral orifice and causes a urethritis, and urinary symptoms also seen in these cases, that is a dysuria or retention of urine or the burning micturition. Some urinary symptoms are also associated with these conditions. Here we have to change the media. Change the media above 4.2. This candid albicans is able to survive when the pH is much acidic condition. So during the mid-menstrual period or mid-cycle or before the menstrual cycle, 3 or 4 days before the menstrual cycle, when the pH is much acidic, which is below the 4.2, this organism is able to survive. So the main advice is given is along with the oral medication, Chandraprabhavati Pushyanaga Churna, as itching is there, so Charmaroga Nashaka Vati or the Arogya Vardhini Vati is advised, and for the external application, Mahamari Chadi Taila or the Karanja Taila, Karavira Taila can be used. And oral medications, as I told you, Pushyanaga Churna, Kanchanara Gugulu to relieve the inflammation, or any Gugulu, Chandraprabhavati to relieve the edema, and Patranga Sava, etc. are given. But here the douche should be done. Yoni Davana or the Yoni Prakshalana should be done. Some Kshara added to it. Usually the Tankan Basma added with the warm water gives a very good result, or the Palasha Kshara or Apamarga Kshara added in the warm water given the douche, or the Panchavalkala Kvada used added with the Tankan Basma or any of Kshara gives you the very good result. And the Pichu, as the cervix got inflamed, it should be treated as a wound. Jatyadi Taila, add a little amount of the Tankan Basma and place it. So it is a healed. Or the Datakya Taila is also works very good. And for the itching, intense itching, the Mahamaricha Taila, Karanja Taila can be applied. Next is atrophic vaginitis. It is a senile vaginitis. This can be correlated with a shushka yoni. That is here what happens. Commonly seen in the postmenopausal condition where the estrogen deficiency led to the dryness of vagina, where the vaginal defense, self-defense of vagina, there is a natural self-defense mechanism is lost here, where the atrophic changes are seen in the vaginal mucosa, that is a thinning of the mucosa, more susceptible to infection. Here, the symptoms commonly seen the cracks, especially the chronic cracks in the vulvovaginal region, and dryness of vagina, discomfort, soreness of the vulva, dyspareunia, yellowish, or sometimes the blood-stained discharge is seen. Sometimes the severe itching is also seen in these cases. So here the snigdha treatment should be done. Here the shushka. Here, according to Adamalla, Shushka Nashtartavam Kalita. Here, the Shushka Yoni happens because of the Nashtartava. Means after the menopause, this atrophic vaginitis or the senile vaginitis can be seen according to the Adamalla. But according to Charka, he explains that the Vevavai Kalarundandya Vegan Prakupito Anilaha. Kuryat Vinmutra Sangarthi Yonim Shosham Yoni Mukasyacha. Here, what happens? Vata, which is due to excessive coitus or etc. The vata which aggravated reaches and causes the obstruction of the Vinmutra Sangam. That is obstruction in the Vit and Mudra and causes the dryness of the vagina. This is the according to Charga. So here the Snigdha Chikitsa is offered. So oral medication, Kanchana Ragugulu to relieve the inflammation, and to relieve the itching, Arogya Vardhini is used, Chandraprabhavati is used, Shadhavari Grutam is an oral medication, and douche is done with the Bala Kashaya, and Eshtimadu Taila, Eshtimadu Kashaya is also used, and Kadamba Kashaya helps in very achieving the atrophic vaginitis relief. So, and external application commonly given is a Bala Tailam or the Jatyadi Tailam helps very good. Bala Tailam, Ishtimadu Tailam, Jatyadi Tailam, Pichu, given, and external application helps very good. When itching is there, the Mahamari Chaditaila helps very good, but the cracks with the burning sensation is seen. In such a condition, Shatavari Gruta, Jatyadi Gruta helps very good. Next, cervical erosion. Cervical erosion is nothing but the Garbhashaya Mukhavrana, where the replacement, the ectocervix and the endocervix are there. Ectocervix is lined by the squamous epithelium and the endocervix is lined by the columnar epithelium. The replacement of the squamous epithelium of the ectocervix by the columnar epithelium of the endocervix is called the cervical erosion. The cervical erosion condition is of congenital acquired. It is seen as a physiological condition during the pregnancy, and where the patient is using the OC pills, oral contraceptive pills, there also you will see the cervical erosion conditions. Here, high estrogen levels, it may be congenital due to the transmission of the hormones to the baby that lead to the cervical erosion seen in the baby. But later, as the levels of the estrogens decreases, automatically the erosion cures on itself. But acquired is because of the infections, that is a chronic vaginitis conditions where the just now we have seen the vaginitis conditions. Apart from those, the bacterial vaginitis is also there, in which the bacterial it is also able to survive above the 6 pH. And in the bacterial vaginitis, what happens? Same means it depends upon the type of bacteria, the symptoms provided the pervaginal white discharge, pain in the vagina, dyspareunia, and pain in the lower abdomen, pain, etc. As just now we have seen the vaginitis cases. There is a pain in the lower abdomen, pelvic pain, and urinary symptoms, and discharge from the vagina, wetness, irritation, itching, dyspareunia, etc. are seen. But a specific symptom of the bacterial vaginitis is that when you will examine the swab under the microscope, you will find the clue cells. That means nothing but the cells which contains a rod-shaped bacteria you will observe in the under the microscope. And when you will add the potassium hydroxide to it, you will experience the fishy odor. That is a sign of the bacterial vaginitis. So where the common protocol of treatment can be applied depending upon the pH. As you have the litmus paper, you can check the pH what is there, and you can change the pH along with the oral medications and the local procedures of Yoni Dhavana and Pichu. So that is a bacterial vaginitis. But here what happens with the chronic vaginitis, which leads to the cervical infections and disturbs the cervical physiological condition and leads to the cervical erosion and high estrogen levels. So in these conditions, in the cervical erosion, what are the symptoms commonly seen is the back pain, pelvic pain, and excessive offensive mucoid mucopurulent discharge, and which is a blood-stained discharge occasionally. Whenever the force is applied on the cervix, it gets ruptured of the small vessels and leads to the blood-stained discharge. Dyspareunia and infertility, when the semen cannot survive because of the altered pH, and the cervix is a bright red in color, just looks like a corrosive or ulcered condition, and with a demarked outer edges. These are the symptoms. When we'll check per speculumly, we'll find in the cervical erosion. In this, the anti-inflammatory Kanchanara Google, Yogaraja Google, Saptavimshati Google were given, and the Dashamolarish or the Varunadi Kasha, Ardashmul Kashaya, Patranga Asava, which is a very good treatment, and Vyadihar Rasan with the Chopchini Adachurna to relieve all the symptoms helps him. And douche can be given with the Palashak Kwada, Kadamba Kwada, or Panchavalkala Kwada, the Shamola Kwada. And Pichu is with the Jatya Taila and Bala Taila with the Lodra Churna inflated. It helps very good. Jatya Taila, the Jatya, the Gruta, or the Vranaropana Taila Pichu gives us very good result, and the Haridra Divarti gives the prevents that infection. Next is the these are the gravis. That is a fibroids. Nowadays, we are the incidence of fibroids, we are finding increasing the incidence of the fibroids. Nearly 20 to 30% of women having, and among these 50% women are asymptomatic in case of uterine fibroids, and especially in the in between 35 to 45 year aged group women. these fibroids are found accidentally or maybe associated, maybe because of the symptoms. The USG was done to the patients and we'll come to know the uterine fibroids. And fibroids are 90% fibroids are the benign tumors. How they grow? There is a neoplastic change happens in the single smooth muscle cell, which leads to the mutation, which leads to the uncontrollable proliferation, which leads to the formation of fibroid. And chromosome varying type and epidermal growth factor, etc., are the affecting and leading to the mutation and uncontrollable proliferation of the muscle tissue that leads to the mascular formation, mass formation, that is the fibroid. Means all the fibroids gets origin in the myometrium only. They are pushed outside or the inside. So depends upon that. When they are present in the myometrium, it is an intramural fibroid. When it's pushed outside, it is a subserous fibroid. When it is pushed downwards inside, it is a subserous fibroid. Next, intramurals are the 75%, subserosal are 15%, and the submucous are the 5%. Histology, if we'll see, the fibrous connective tissue is seen whitish smooth surface, false capsule, and vascularization in peripherally laced at the centrally and contains smooth muscles. And the common symptoms we'll come across are the menorrhagia, metrorrhagia, dysmenorrhea, dyspareunia, pain abdomen on and off, and infertility in cases, and the pressure symptoms, that is a dysuria, constipation, retention of urine. And if we'll examine parabdominally, hard mass with the defined margins and restricted mobility, you will see dull unpercussion and undergoes the secondary changes, that is a different changes, calcium degeneration, etc. Hyaline degeneration. If you go into the Ayurveda, it can be considered as a Mamsaja Grandhi. Here the Vagbata, that is the Snigdham, Mahantam Katinam, and Siradham. Here means the periphery has, as I told you, the vascularization more in the peripheral and least at the centrally. So here he has Siradham, means it is a vascularized condition, and Katinam, hard to touch, and Mahantam, it is a big, and Snigdha. And these are the common symptoms explained by the Vagbhat. The oral medication commonly advised in the Ayurveda is the Kanchana Varunadi Kashayam and Mamsa Pacha Kashayam helps very good with this. Given to the patients, got the very good result also. Mamsa Pacha Yoga Nimba Patola, etc. are given, and Yoga Basi Krama and Uttar Basi helps in relieving the fibroids or the decreasing the size of the fibroids. So the patient gets relief of the, and the common cysts. This is the attached wall growths. So there's nothing but, and this cyst is a fluid sac on the surface of the ovary, may involve the ovarian wall or not. And cysts are different types: follicular cysts, functional cysts, luteal cysts, and benign neoplasms such as the chocolate cyst, complex cysts, and mucinous cystadenomas. And it depends upon the condition and size and location, the symptoms vary. But common symptoms are the dyspareunia, dysmenorrhea, pain abdomen on and off, depends upon the size of the cysts, irregular menstrual cycles, amenorrhea or the menorrhagia, parvaginal discharges, bloating abdomen, etc. are seen. Next, can be correlated with the Kaphaja Grandhis, that Mishnah says, Shito Vivarna Alparojo Hatikando, Pashanava Samharanopannaha, Chirabhiruddhisa, which develops very slowly, and discharges are the Vishruklaganam Puyam, which contains inside the Puyam, that is, and it is cold to touch, and it is a Vivarna, discolored one, and Alparoja means less pain. And the common medication advised in the text is the Yoga Vasikrama and the Kapha Vata Hara Taila, etc. Bokshrad Gugulu, Kanchanara Gugul, Dashmala Kashayam, Varunadi Kashayam, Chandra Prabhavati were advised. Next, coming on to the cases. Hello, Jinsi? Hello?
Yes, ma'am. Yes, ma'am.
My voice is clear, no?
Yes, ma'am. It's clear, ma'am.
Okay. So let's see the clinical cases. This is the case. Sujata, of the age of 35 years, suffering from the infertility with the irregular menstrual cycles. Her first baby was 10 years old, but she is unable to conceive because of the infection she got. She suffered with a tubercular infection. Later, it's diagnosed as a bilateral tubal blockage. She is unable to conceive. She went for the IVF, where it's a failed. So she didn't get achieved the conception. So later she came to us. Actually, the patient was advised to go for the tubal recanalization, but she don't. Next, she came to Ayurvedic treatment. In the first month, she was treated with the Kanchana Ragugul Chandraprabhavati, as she is having the irregular cycles. To regulate her cycle, first the Raja Pravartini Vati Dashamularishtam, Apankal Chandraprabhavati was given to the patient, and Kanchana Ragugul was given to the patient. After getting a one cycle, then the Raja Pravartini was not given, and Elos compound is advised for the 20 days, first 20 days of the cycle, and Kanchana Ragugul for first 15 days of the cycle, and Dashamula Arishta throughout the month. And in the third month, she was treated only with the Kanchana Ragugul and Dashamula Arishta, as she got the cycle herself without Raja Pravartini Vati, without Elos compound. And in the fourth month, she was given the Garbhadharini Vati, Chandra Prabhavati, Apankal Chandra Prabhavati, Dashamula Arishta, and Elos compound. And 2 cycles of Uttar Basti was done with the Kshara Taila, and the third cycle was done with the Bala Taila. And after that, the bilateral tubal patency is restored and the patient got conceived. Now she is in the 13th week of gestation. Here you can see the bilateral osteal blockage when she undergone for the hysteroscopy, diagnostic hysteroscopy was done. And here you can see the HSG report of the patient where the bilateral tubal patency is restored, and this is her conceivement report. You can see now she is receiving the Garbhafal Ras, and up to 12 weeks she was advised to take the folic acid and the Dufestron 10 mg BD, folic acid 1 OD, and Garbhafal Ras and other Datri Loha 1 BD. She was advised. Now she was advised. Now she is in the 13th week. Now she is taking the iron and calcium, Garbhafal Ras, and a company syrup called the Foblet. Next, this is a one more case where the 35 years of women. That is she came to us with the complaints of the pain abdomen on and off, dyspareunia, pain in the pelvic region and heaviness in the pelvic region, continuous white discharge, and recurrent urinary tract infections. So on USG findings, it's known that the left ovarian cyst is there, but she's a case of the hysterectomized case where the right ovary and the uterus was removed 3 years back because of additions formed with the ovary to the uterine wall. So uterus and the right ovary were removed 3 years back, but here the left ovary was present, and that left ovary has got a developed the ovarian cyst with the internal septations, and the patient was having the above symptoms, and there is a discharges, and which is very irritating to her. Then the patient came to us for the Ayurvedic treatment, as she is a P2L2 with 2 cesarean sections. So she's not interested to go for the further surgery, and she approached the Ayurvedic treatment. And in the first month, she was given the Chandraprabhavati and Dashmul Kashaya, Pushyanga Churna to relieve the white discharge, and Kanchana Ragugulu for the anti-inflammatory action, and Dashmul Kashaya Chandraprabhavati to relieve the edema, means Shodhahara. And a specific preparation which is given in my clinic, that is the Andashaya Grandhihara Churna, which is prepared with the Shodhahara and the Shulahara drugs, and 3 of the Lekania drugs are added to it and given to the patient every day in 2 to 3 grams, morning, evening 2 grams, and evening 2 grams were given with the warm water. And after that, in the second month, the Chandraprabhavati, Dashmul Kasham, Kanchana Ragugul were given, and in the third month, only Dashmul Kasham and Chandraprabhavati were given to the patient along with that specific preparation, Andashaya Grandhihara Churna. So for one cycle of Yoga Basti Krama was given to the patient with the Mahanarayana Taila and Sachara Taila, and Dashmul Kashaya was with the Dashmul Kashaya. After that, she got relief. There is no cyst and the USG findings are normal. You can see the reports of the patient here. She approached to us in the October month, and in the November, December, January, she was given the treatment. Later in the February, she went for the USG again. You can find this is a post-hysterectomized case where the right ovary is not visualized, means it is removed, whereas the left ovary is normal and the cyst is disappeared completely. Though it's a complex left ovarian cyst, the result came with the Ayurvedic treatment. So next, this is the case of adenomyosis. 45 years of female approached us with the bleeding, heavy bleeding in the menstrual cycles, which was extending up to the 10 days, 8 to 10 days regularly, and which contains the big clots in the bleed. and dysmenorrhea, severe dysmenorrhea and intermittent spotting in the cycles, discomfort and pain which is on and off and varying with the severity or intensity in the pain abdomen is seen in the patient. And she's a known case of the hypothyroidism. She was receiving the 50 mcg of the thyroid, and thyroid was in control. And the patient when came to us with the USG reports, that is adenomyosis with uterine wall fibroids, posterior uterine wall fibroids, which is of a 33, I think, 3.3 mm, 3.3 centimeters. So as she is in a premenopausal condition, so she was not interested to go for the surgery, and CA 125 was normal. So the patient came for the Ayurvedic treatment to get the relief of these all symptoms, as she will get the menopause within 3 or 4 years. So here the first month she was given the Mamsa Pachak Yoga, Chandrakala Rasa, Kesaradi Churna, a specific preparation which controls the bleeding immediately, adding the Stambhana drugs and the Shodhahara drugs. Among them, the 5-5 are taken and given to the patient. Kanchanara Gugulu and Ashokarishta were given in the first month, and cycle, first Uttarbasi cycle is given with the Ksharatela. Second month she was treated with the Kesaradachuna, that as I told you, the preparation, and Chandrakalaras, Mamsa Pachak Yoga, Kanchanara Gugulu for only for 15 days was given, but the remaining 3 are continued for 1 month. And the third month, only the Chandrakalaras, Mamsa Pachayo, Kesaradi Churna was given to the patient. And first 2 cycles of the Uttarbasi was given with the Ksharatela, and third cycle is given with the Dhanvantaram Thailam, and fourth cycle is given with the Lekhaniya Gana Thaila. The Charakukta Shedvirechana Shatashritya chapter, the Lekhaniya Gana, which is taught. Among them, I have got the 6 of them, and that is prepared in the oil form, and the Lekhaniya Thaila is given to Uttarvasi to the patient. By the next, after that, the coming month, she was advised to go for the USG. There is no fibroid seen, and adenomyosis is completely cleared. Here you can see the reports. Bulky uterus with adenomyosis, the posterior one, that is a 33 mm, that is 3.3 centimeters and 2.6 centimeters of fibroid which was present in the posterior wall, got relieved, and there is no. Now the patient is in the 4 months amenorrhea. She is happy. She is relieved of all the symptoms. When the treatment was started, after completing the first cycle of Yoga Basti, first cycle of Uttar Basti only, the patient got relief of almost all the symptoms, except the pain abdomen, which was also relieved, but mild pain was existing on and off. By the second cycle, she got complete relief of symptoms. And this is the one more case of right ovarian cyst. There's a mucinous cystoadenoma case, which is an interesting case. She's a 30 years old woman and suffering from the pelvic pain, irregular spotting, and vaginal discharges, dysmenorrhea, dyspareunia, bloating abdomen, and menorrhagia with a severe dysmenorrheic condition, and known case of the hypertension and hypothyroidism, using the anti-hypertension medicine and the 50 mcg of the thyroid thyronam tablet. And she was having the right ovarian cyst, which is a mucinous cystoadenoma of a very big size, that is 11.8 centimeters. So with the internal septations, actually this patient was posted for the surgery, but due to the anesthetic hazards, the surgery was not done, and she was advised to take the Ayurvedic treatment by the famous gynecologist Swapnalata ma'am here, and she came to us for the Ayurvedic treatment. In the first month, she was treated with the Chandraprabhavati Dashmal Kashaya, Kanchanara Gugulu, and the preparation of the Vedanga Churna, Trifala, and Punarnava Churna is given to make a decoction, and daily ask her to drink in the empty stomach. And in the second month also, she was treated with the Dashmal Kashaya, Punarnavad Mandura, and Kanchanara Gugul. And in the third month also, the same treatment was followed. One cycle of Yoga Basti with the Sahacharadi Thailam, Dhanvantaram Thailam is given, and Dashamula Kashaya as a Kashaya was. The second cycle is given with the Dhanvantaram Thailam and Maharasnadi Kashaya. Later, the cysts came to decreased in the size. But after the third month of treatment, but in the third month, only the oral medication was given, no Panchakarma is not given. There is a Basti Karma is not employed in the third month. And after 2 months of that, the patient, she got complete relief of all the symptoms. But after the 1 month of treatment, the second month, she went for the scan, and you can see the reports. This is the first report when she came to us with the 11.8 centimeters mucinous hysterodyma after the 2 months of treatment. When she came to us in October 2019, and here, this is the January report, November, December. This is the January. After 2 months of that, this, you can see the cyst size. This is a 33 into 35, so 3.3 centimeters. After that, she was given only the oral medication, no Panchakarma treatment. Here you can see there's a report, quite normal report, completely cured cyst. Next, this is one more case from the 34 years of, she's a infertility case, primary infertility case with a marital life 3.5 years, suffering from the pelvic pain, dysmenorrhea, leucorrhea, with the right ovarian cyst and the hemorrhagic cyst and bulky cervix. She was treated with the first month with the Kokshuradi Gugul, Varunadi Kashayam, Pushyanuga Churna, and Garbhadarani Vati. And one cycle of Yoga Basti is given to her with the Dhanvantaram Tailam and Dashmula Kashayam and Varunadi Kashayam. Both were added and given. With her, the sister disappeared and she got conceived. Here you can see. This is the hemorrhagic ovarian cyst. Here the cyst is quite normal. After the successive month, after the 2 months, successive 2 months, she got conceived. Next, this is a 40 years old woman with a multiple fibroids, and came to us with a menorrhagia, dysmenorrhea, pain, abdomen, low back pain, and bloating, abdomen, general weakness, and big clots in the menstrual flow. So here the multiple fibroids, and the largest was measuring about the 8.3 centimeters, and she was treated with the Rasnadi Gugulu and Kesaradi Churna, which contains the Sambana Aushadis and Shodhahara Aushadis. As I told you, that is a specific preparation used for controlling the bleeding, which gives a very good result in the menorrhagia and metrorrhagia cases. And Chandrakalaras Dhatri Doha. Uttar Basti with the Ksharatela was done, and in the second cycle, Uttar Basti with the Ksharatela and Dhanvantari Taila is given. In the first, fibroids has reduced in the first 2 months, and fibroids has reduced further after third cycle of Uttar Basti, which cannot be measured by the USG. Here you can see. Bulky uterus with the intramural fibroids, and the fibroid size is not measured. It's just 4 mm here. And here it was 8.3 centimeters. Here it is of 4.7 centimeters. After that, the fibroid size is not measurable. So normal report. Next, this is another 50 years old women where the menorrhagia, metrorrhagia, dysmenorrhea, pain, abdomen, low back pain, and dyspareunia, pain in both lower limbs, etc. are the symptoms where the 2 intramural fibroids have been, focal adenomyosis was there. And she's a known case of hypothyroidism and hypertension under medication. And she was treated with the Chandrakalaras and Kesaradi Churna, Kanchanarapigulu, and Mamsa Pachaka drugs are given to this lady. And Yoga Vasti Krama with the Dhanvantaram Thailam, Sahacharadi Thailam, Dashmula Kashayam was given. And in the second cycle, the oral medication is Mamsapachak drugs, Kesaradi Churna, Kanchanarapigulu. So no need of Chandrakalaras also. The bleeding was controlled. And Uttar Basti with the Ksharatela was given. In here, the one fibroid is disappeared completely, and another reduced in size, and the patient got complete relief of the symptoms. Now she attained the menopause. Here you can see. Okay. So this is the case. Next, this is an infertility case, and this is an interesting case as the patient is a situs inversus case, means the organs are placed on the right side. Means situs inversus case means organs left organs are placed in the right and right in the left. So with a marital life of 3 years, primary infertility case, and bulky left ovary with the bilateral PCOD condition, and the torch positive was the status of the patient, and she was given the oral medication Dashamula Arishta Garbhadarinivati, torsional capsules allows compound Chhatraprabhavati. And she was treated with a 1 cycle of Yoga Basti and 1 cycle of the Uttarvasti. And with the 101 Avartita Balataila Uttarvasti was given, and Dhanvantaram Thailam is given. Dhanvantaram Thailam and Dashmul Kashayam is used for the Yoga Basti process. Patient got conceived and delivered also. Here you can see. This is her first report where the enlarged is. You can see the bilateral increased central echogenicity of the multiple follicles, the situs inverse, the bulky left ovary with the bilateral polycystic ovarian patterns. So here, this is the treatment given, and this is the result achieved. Now she delivered also. Next, this is a Shweta patient. This patient is having the fibroids in her uterus and suffering from the primary infertility case, menorrhagia, dysmenorrhea, and she was given a hypothyroidism case and left ovarian cyst was there, and she was given the Yoga Basti with the Kshira Balataila, Dhanvantaram Tailam, and Dashamula Kashayam. Uttar Basti was given with the Kshara Taila, 1 cycle only. Kanchana Ragul Dashamula Arishta and Nagesha preparation was a specific preparation used for these cases to improve the conditions where the fibroid should be reduced and the achieving conceptual condition should be increased. Garbhadharini Vati and Brahmi Vati was given to the patient, and 2 fibroids disappeared in the years and patient got conceived. Here you can see, here these are the fibroids when she came to us, and after the treatment she got conceived, and the fibroids 2 disappeared and only 1 fibroid of 2.4 centimeters is remained there. Next, this is a one more case of 26 years of women with a secondary infertility case and suffering from the ovarian cyst of 3.9 centimeters and endometrial hypertrophy, PC, polycystic ovaries, and non-ovulatory cycles with the irregular menstrual cycles. And the patient was given first to regulate the cycle, the Raja Pravartini Vati and the Dashamula Arishta Kanchana Ravugul were given. And in the second cycle, she was given the Garbhadharini Vati Allos compound and the Dashamula Arishta. And you can see here, Yoga Basti was given 1 cycle and the Uttar Basti was given 1 cycle with the 101 Avartita Balataila. Automatically the patient got, she was having this, here, she got and conceived also. So, tubal blockage, ovarian cyst. This is just now I discussed about this case, ovarian cyst, etc. And next, she got conceived here. This is the one more case of polycystic ovary and torch positive case, but cycles are irregular, delayed by 1.5 to 2 month cycles with a marital life of 5 years, primary infertility case and PCOD condition, torch positive case. A capsule torchnil was given for the 3 months, and to regulate the cycles, Dashamula Arishta, Chandraprabha and Raja Pravartini was given, and after that the Allos compound, Garbhadharini Vati and Dashamula Arishta were given. 1 cycle of Yoga Bas and 1 cycle of the Kshira Balataila. 1 cycle, first cycle is given with the Dhanvantaram Thailam and the Dashmula Kashaya, and the second cycle is given with the Kshira Balataila and Dashmula Kashaya. Patient got conceived, and the normal USG report was got all the symptoms relieved and all the pathological conditions relieved. Later, in the successive 3rd month, she got conceived. So this is one more case of IVF failure case, where the endometrial insufficiency was there, and with a marital life of 5 years, primary infertility case with the irregular menstrual cycles and leucorrhea was there, and IVF and 3 times IUI was done to the patient, and the laparoscopy was also done to the patient. So first regulate the cycles, these medication are given. Later for the conception, the other medication is given with the first cycle of Yoga Basti is given with the Dhanvantaram Thailam and Dashmula Kashayam, and second cycle with the Kshira Balataila and Dashmula Kashayam, and Uttar Basti is given with the 101 Avartita Balataila. These are all the reports of IVF when she went for that. Later, she got small follicles and polycystic. These are the her reports, previous reports, and after that she got conceived here. Next, this is one more case of the secondary infertility. First was the abortion. Later, she came to us with irregular menstrual cycles, so ovarian cyst, PCOD, and torch positive, and these leucorrhea conditions where the Dashamula Arishta Kanchana Ravugula Allos compound Kshira Balataila Garbhadharni vati, Rajapravatini vati, Falasarpehi are used first to regulate the cycles, then improve the chances of conception. The Garbhadharaka medication was given to the patient with a 1 cycle of Yoga Basti, Dhanvantaram Thailam, Dashamula Kasham, Uttarvasi with the Manatman Avartita Balathaila. The successive second month she got conceived. Okay. So she got conceived. This was the first report. After that, she got relief of the cyst, and here she got the conceived. And this one more case of this very complicated case of 35 years of female with a known case of diabetes mellitus, hypothyroidism, and primary infantile bilateral tubal blockage, and a torch positive status. And she suffered with a tuberculosis in her childhood. So she received the 9 months of the medication, and it was very tough to open these. The 4 cycles of Uttarbasi was given to the patient, 3 cycles with the Ksharathaila and 1 cycle with the Balathaila. Later, you can observe here. After that, she got conceived. Before going to the HSG, the patient got conceived in the 5th month. This is a one more case of the TB endometritis. He used to AKT for 9 months, and primary infertility case having the bilateral tubal blockage. As the patient belongs to the medical field, after 2 cycles of the Uttarvasi, the oral medication completed. She went with the enthusiasm whether the tubes open or not. She got open of the right tube here. Right tube is opened. After that, she came to the further treatment and she got conceived. Next is the Anusha case. This is a bilateral tubal blockage case with the primary infertility, and she's a known case of the bronchial asthma with a marital life of 6 years. And 2 cycles of Uttarbasi was given to the patient, and with the oral medication. She went for the HSG in the 3rd month, whether the Ayurveda works or not. She want to know, as she is a pharmacist in the famous hospital here. So normal USG is a normal HSG is seen that the bilateral tubal patterns is restored here. After that, she conceived and she delivered this Jansi patient. She is suffered with the bilateral tubal blockage, endometriosis in the additions. She was posted for the surgery, but that failed. And after that, she was advised with suffering with the dysmenorrhea, dyspareunia, and on end of pain, abdomen, pelvic pain, discharges from. So she was treated the oral medication, Pushanga Churna, Kanchana Ragulu, Patranga Asava was given to the patient, and 3 cycles of the Uttarvasi was given to the patient along with the oral medication. Both bilateral tubal patterns is restored and conceived and delivered. Here you can see the HSG report. Next is a Kavya patient. This is a polycystic ovarian disease case with the primary infertility bilateral tubal. You can see in the X-ray in the slide, there is both the tubes are blocked. 3 cycles of Uttarbasi was given, and later the patient got open. Means tubal patterns is restored on both sides. This is one more case of bilateral tubal blockage. She was given the 2 cycles of the Uttarbasi with the oral medication, and here you can see both the restoration of patency in the tubes. So Revati patient, this is a right tubal block case. Left is a open one, right is but she suffered with a TB infection in the childhood. So she was treated with the 3 cycles of the Uttarbasi with the oral medication. After that only she got conceived, and tubal patency is restored on both sides. Thank you. Hello, Jinsi.
Thank you so much, ma'am. Thank you so much, ma'am, for taking your time to prepare for such an extraordinary enlightening session, ma'am. We will now go ahead to the question and answer session, ma'am.
Sure.
Shall we begin, ma'am?
Yes, sure.
Yes. I request all the participants attending sessions in Zoom, website, YouTube, and our app to raise questions in the discussion panel. Ma'am, there is a hand raised, ma'am. May I unmute her, ma'am?
Sure.
Yes. Dr. Sapna Shukla, you can unmute yourself. Dr. Sapna?
Hello.
You may unmute.
Hello. Good evening, ma'am. Thank you for the wonderful session. It was very interesting and amazing session.
Good evening.
Ma'am, actually, I wanted to ask, I had a case of 19-year-old girl
Okay.
And before 3 months, when she came to me, she was having left ovarian simple cyst of 3.5 into 3.1 centimeter.
Okay.
Then I gave her Kanchana Gugul with Vriddhi Vadika and Dashmularist and one uterine tonic. Continued for 3 months. Then after 3 months, when she came, left ovarian cyst is resolved, but she had another report, a right ovarian cyst of more bigger size, 4.5 into 4.2 centimeter.
Okay.
So is it possible, means while treating one, other cyst may develop?
In case it doesn't happen normally. Maybe in the first time also she was having some bright ovarian cyst, but it's of a very less size one. So it is not, it may be not noticed at that scan. But after that, when it is increased in size, it may be came into the notice. Think so.
So, ma'am, how to proceed for it? Means left ovarian cyst is cured, but it was there in the right. So, how to proceed with such case? I have also seen such case first time only.
Yes, I have seen the bilateral ovarian cyst cases. But while
Means, ma'am,
treating,
while resolving one, another developed.
no problem. It's a simple as it's a simple cyst. It definitely it will disappear with the Ayurvedic treatment. You go for one cycle of yoga basti with the
Okay, ma'am.
one cycle of yoga basti. If the patient is willing, it's beneficial because she's a 19 years girl, so it's better to go for the one cycle of yoga basti along with your, as you said, the oral medication which you have given, which you feel it's a very good, you can give that. And normally I advise the Chandraprabhavati and Dashmula Kashaya. As I told you, Andashaya Grandhi Hara Churna, that is that works very good. And one cycle of yoga basti you can go. Then there will be no development of a cyst in other ovary.
Okay, ma'am. Could you please explain the contents of Andashay Shodhar?
Just it contains a Shodhara and 3 of Lekana drugs, that is a Haridra, Daru Haridra, Musta, 3 of them, and Shula Prashamana of the Pipali Mula. These 2 are given, and Shodhara of Bilva, Agnimanda. Bilva and Agnimanda. These are the preparation especially used, which are prepared in my clinic, and I am using it, and which is giving a very good result in relieving the cysts in all types of cysts. It's working on the all types of the cysts. That's why I just named it as a Dashaya Grandhihara.
Ma'am,
Okay.
all content should be taken in equal quantity?
Yes, all are in equal quantity. Okay.
Okay, ma'am.
Okay.
And ma'am, just one more question.
Pardon. Please.
Dr. Sapna, are you there?
Sapna ma'am, are you there?
Dr. Sapna?
Hello.
Ma'am, boliye. Tell me, ma'am.
Ma'am, I want to ask, many times the patient comes, patient is having no pathology, no ovarian cyst, no dysmenorrhea, nothing. Patient comes with the UPT kit positive. But then again, after 7 days or 8 days, it becomes spontaneous abortion. So how should we proceed in such case when patient comes with UPT positive and with bad obstetric history?
See, the elevated hormones gives the HCG positive in the urine, isn't it? So it may be because of the drugs, or maybe increased, or the usage of the progesterone in from the 14th day they have started. Maybe they are the possibilities, and we have to wait. But meanwhile, you, as the patient comes to you with a UPT positive, will start the progesterone, isn't it?
Yes, ma'am.
Yes. So wait for a week, and it may be suspected as a bladder ovum, etc. So missed abortion. So that may be clearly investigated. Means, is there any infection or any history in the previous history she was there, or any infection, touch infections, or etc. or her day-to-day activities, etc. You have to ask, and ask her, as you have started the progesterone, it should stay. If it is eliminated, it's nothing we can do, but we have to clear, and after that we have to wait, and after 3 months of ask her to get conceived again.
Okay, ma'am. And ma'am, just last question, ma'am.
Pardon.
You told Sarpushpa Nashyan to be given in means can we give this in the patient of infertility throughout the cycle or for a particular number of days?
Pardon.
Sarpushpa oil Nashyan.
Shetapushpa oil, Nasya, I gave only for the 6 patients, and that too only 1 cycle I have given.
For how many days?
5 days.
Means
Only 5 days.
after menses.
After menses. After
Okay,
menses.
ma'am.
Started from the 6th day and stopped on the 10th day.
Okay, ma'am. Okay.
Okay.
Thank you, ma'am.
Welcome.
Thank you, ma'am, and thank you, doctor. There are a few more hand raised, ma'am.
Sure.
May I unmute, ma'am? Dr. Firdaus Jalal, you can unmute yourself. Dr. Firdaus?
Yeah. Hello, ma'am.
Yes, good evening. Tell me.
Good evening, ma'am. I have a case of patient, age 43. She have failed IVF
Okay.
and bulky enlarged uterus with multiple cysts and fibroid with cholelithiasis. So I have give her many M2 tone syrup, Kanchana, Google, Sonitargar, all that, but there is no effect. So what would we do?
So what are the symptoms? As her age is 43
She had
years.
43 years.
43 years is
She
a
have
premenopausal age.
dysmenorrhea, menorrhagia, and but she want to conceive.
Okay.
Very difficult case I had seen.
43 years means
Yes, ma'am.
it's a premenopause age. So we can't expect a pregnancy. But as you said, she is suffering from the many symptoms. The symptomatic relief we can give to the patient.
Yeah, I just tell her everything, but she want to conceive.
So what about her husband?
Husband, every report is normal, ma'am.
Okay. Can you forward her reports to me? I'll go through once the reports and I'll make you to do the better. I think so. But she's anyhow, she's in a premenopausal condition.
Yes.
But you can go for the Panchakarma procedures. 2 cycles of Yoga Bhasti and 1 cycle of Uttar Bhasti may help her definitely in relieving the symptoms and in improving her conditions, and it may improve the chances of conception, but not sure because her age is not permitting, because it's at 33 years, 43 years is a means. So very less chances because the ovarian reserves will be decreased. No.
And she took
What
many
about her
injections,
AMH?
oxytocin,
What about her AMH?
I don't know till now.
Because as the age advances, the ovarian reserves decreases, and depends upon our AMH, we can judge. So how many ova are balanced or etc. And we can try. And it's better to go for 2 cycles of Yoga Bhasti, then 1 cycle of Uttar Bhasti. You try in her. Definitely it helps her in relieving all the symptoms.
Please?
Pardon?
Can I have your number, please?
Sure. You can get from the platform from Jinsi ma'am. Jinsi ma'am, please
Yes, ma'am. Yes,
share
ma'am.
my
We'll
number
share.
to this madam. Okay.
Okay, ma'am. Okay, ma'am.
Okay.
Thank you, ma'am. Thank you very
Welcome.
much.
Welcome.
Thank you, ma'am, and thank you, doctor. Next hand raises Dr. Mukesh Kumar Jadhav. You
Sure.
can unmute yourself. Dr. Mukesh? Dr. Mukesh, are you there? Dr. Mukesh, are you there? Okay, ma'am. We'll go for the next hand raise, ma'am. Dr.
Sure.
Pushpanjali.
Good evening, ma'am.
Good evening. Good evening. Certainly.
This session is very interesting, ma'am. Thanks, ma'am.
Thank you.
One question, ma'am. Ma'am, many patients repeated white discharge, ma'am.
Yes.
Repeated.
Pardon?
Please, ma'am.
Pardon? Your voice is breaking, Dr. Mukesh. Please. Can you
Many
repeat?
patients are complain white discharge many times, repeated time.
You want to ask in Marathi, you can ask. No problem.
Hello.
Hello? Hello?
Yes, ma'am. Many patients are complain
Okay.
repeated white discharge, ma'am.
Okay.
Weakness.
Yes. That's a leucorrhea cases. And
Yes,
as I told you, the leucorrhea normally will come across in the regular practice. 2 types of leucorrhea we'll see. That is a type of, what is a type of discharge? First ask the patient. If it is a curd-like, So you can decide it as a candid infection, that is a Candida albicans, a fungus infecting her vaginal mucosa. That fungus is able to survive in the much acidic media. When the pH of vagina changes, means decreases below 4.2, the fungus is able to survive in that media. So ask the patient whether what type of discharge she is suffering. And in fungal infection, normally the itching is a complaint of the patient. So if the discharge is a white curdy discharge, first you alter that pH. If the patient is a married girl, if she's a married one, go for the douche. Means you use some kshara added decoction, means as a palasha kshara added to the dashmul kashaya or panchavalkal kashaya added the tankan basma, given the douche. And if she check the cervix, if the cervix is also gets inflamed, so pichu with the bala taila or the jatyadi taila you can use. If she's an unmarried girl, the oral medication in both cases, means married unmarried, the oral medication give you the better good result. That is a Pushanga churna you can give, or many other pharmacies are preparing, especially the Himalaya pharmacy, which is having a Leucol, a tablet which works very good in the Leucorrhea cases. All types of Leucorrhea, it gives a very good result. Or otherwise, if you want to go for the classical medication, you can use the Pushanika churna with the Tandu Lodaka and Kanchanara Google to relieve the inflammatory condition, and Chandraprabhavati to relieve the edema condition, and Patrangasava helps you very well in these cases, or Lodrasava. Patrangasava or the Lodrasava you can give to the patient. If she's a married woman, better to go for the douche along with oral medication. And check her the HB levels, because the less hemoglobin levels, so the less supplementation of glycogen, less conversion of the lactic acid, and leads to the further disturbance in the vaginal flora. That is a self-defense mechanism, and recurrently the infection happens. Okay. If the discharge is not white curdy discharge, if it is a watery discharge with a greenish yellow in color, and complaints of the pain and recurrent urinary tract infection symptoms, then it can be suspected as a trichomonas vaginalis. Alter the pH, which is of a 6 above, so it should be bring to the 4.2. Then you have to use the douche with the Triphala kashaya, or you can use the Panchavalkal kashaya added with the Amalki churna, etc. But the Amalki kashaya can be also used, and Jatyadi Taila Pichu helps you very good, as a strawberry cervix formed due to the inflammation of the cervix. Okay. Mukesh sir?
Dr.
Hello.
Mukesh, are you there? I think he is not
He's
there.
muted. Okay.
Okay,
Okay, thanks, ma'am.
Oh, okay. You are there. Okay. Next.
Thank you, ma'am, and thank you, doctor. Next one is Dr. Pushpanjali.
Yeah.
You may unmute yourself. Dr. Pushpanjali, are you there? Moving on to the next person, ma'am.
Sure.
Yes, ma'am. Dr. Lakshmi Singh.
Hello,
Dr. Lakshmi.
ma'am. Good evening, ma'am. Pushpanjali. Hello. Hello, ma'am. Can you hear me?
Yes,
good
yes.
Evening, ma'am. Good evening, ma'am.
Good evening.
Ma'am,
Yes.
I have a case of like 20 years girl having subserosal uterine fibroid, measuring 2.8 into 2.0, like totally 5.6 centimeters. Along with bilateral ovarian cyst.
Okay.
So, what should be the mode of treatment in this plan, ma'am?
So 20 years girl, no, the subseral fibroid will not be showing any symptoms. I think so. A little mild dysmenorrhea may be present in her. That's isn't it? And the ovarian cyst, of a size of ovarian cyst?
No, ma'am. It is like bilateral PCOD. Sorry.
Okay. Then nothing to worry. Her cycles are regular?
Yes, ma'am. Like in between, it was not regular. When I started Kanchanara Gugulu and Chandra Prabhavati.
Yeah, exactly.
Yes, ma'am.
So you have started the Chandraprabhavati and Kanchanara Gugulu. You please advise the Chandraprabhavati to take in the Apanakal and add some Dashamula, means Shotahara preparation to you as the Dashmula Rishtar, the Dashmul Kashaya. So it relieve the definitely clears the PCO. If she is interested, you can employ one cycle of yoga basti to her. And as it's a subseral fibroid and of a 2 centimeters, isn't it? So it does.
2.8,
Yes,
2.8
2.8
into
centimeter.
2.0,
So
ma'am.
it will not disturb the any physiology of the uterus, and very mild dysmenorrhea may exist or may not exist. So nothing to worry about that. Just leave it, and just you go for one cycle of yoga basti, and it further helps in the decrease in the size of the fibroid, as well as it clears the PCO. And as you said, her cycles are regularized with the oral medication.
Yes, ma'am.
Nothing to worry then. Okay.
Okay.
One cycle of yoga basti, you please, if the patient is accepting, giving the consent for that.
I don't think so, ma'am, because yeah, she
but
will not
advise
be
her,
ready.
and if possible, advise her and explain the benefits of basti to her, so that her entire reproductive system gains the strength. In future also, she will not suffer with any problem. As she's a 20 years, so after 4 or 5 years she is going to get married. So after marriage also, you will not have any types of problem, and then there is no problem in the conception also. You just explain to her and it will be benefit to her. Okay.
Ma'am, I have one more case. Like
Yes.
a female, she always she gets UTI infection immediately after coitus, but there is no problem with husband also, and no problem with the wife also.
So husband may be acting as a carrier for the infection, and this women who is having the already some amount of the vaginitis, naturally she's got inflamed many times. So this is increasing as her immunity is low. So both the partners should be treated simultaneously. So that gives a better result, and she will not be infected again and again.
Okay, what should be the mode of treatment in this case, no?
You can use the Chandra Prabhavati and Chandana Sava if her husband and she herself is not a diabetic. And one more thing, you can advise her to take the Dhanyaka Hima regularly for 1 month, which helps a lot in clearing the chronic UTI.
Okay, ma'am.
Okay.
Thank you so much,
Thank you.
ma'am.
Welcome.
Thank you, ma'am, and thank you, doctor. The next hand raise is for Dr. Pushpanjali.
Yes.
Dr. Pushpanjali, you may unmute yourself. Dr. Pushpanjali? I think
she now talked. Okay.
Yes, ma'am. Moving on to the next person, Dr.
Hello.
Sanjay.
Hello. Hello, ma'am. I am Dr. Pushpanjali.
Okay, ma'am. Boli.
Ma'am, can you hear me?
Yeah, you are audible.
తెలుగులో మాట్లాడచ్చా?
తప్పకుండా అమ్మా. Sure. You can.
మ్యామ్, పేషెంట్ కంప్లైంట్ ఏంటంటే కంటిన్యూస్ బ్లీడింగ్ ఉంది.
కొంచెం లౌడ్ గా అమ్మా, కొంచెం లౌడ్ గా. వాల్యూమ్, a little bit volume.
హలో మ్యామ్.
అమ్మా చెప్పండి అమ్మా.
పేషెంట్ కి 7 days నుంచి బ్లడ్ క్లాట్స్ ఉన్నాయన్నమాట.
ఓకే.
ఫస్ట్ పీరియడ్ స్టార్ట్ అయింది, జస్ట్ ఓన్లీ స్పాటింగ్ ఉందన్నమాట ఫస్ట్ డే. తర్వాత నుంచి ఫుల్ బ్లీడింగ్ అవుతుంది, బట్ బ్లడ్ క్లాట్స్ ఎక్కువగా ఉన్నాయి. యుఎస్సి స్కాన్ తీపిస్తే ఇంప్రెషన్ వచ్చి అనెకాయిక్ సింపుల్ సిస్ట్ ఇన్ రైట్ ఓవరీ అని అన్నారు. ఏంటి మేడం అది కండిషన్?
ఎనెకాయిక్ సిస్ట్ ఉందమ్మా, అంటే ఓవరీలో సిస్ట్ ఉంది. బట్ వాట్ అబౌట్ ద ఎండోమెట్రియం థిక్నెస్?
ఎండోమెట్రియం ఒక్క నిమిషం. Endometrium thickness is normal అన్నారు మేడం. It measures 7.6 centimeter.
Okay, so the bleeding will stop within the 5 or 6 days. No problem. And this cyst doesn't because of, what is the size of the cyst?
2.6 into 2.2
it's a very small size cyst. I think it's not responsible for the menorrhagia, and the patient is having the continuous 7 days flow and with heavy in nature, and maybe thyroid hypothyroidism should be tested.
Okay.
Suspected So ask her to go for the thyroid. T3, T4, TSH should be done. Then we'll check if TSH is seen and hypothyroidism is seen. First, we have to treat that. Automatically, this will cure on itself. And first, you stop the bleeding with a Rakta Bandhini and Chandrakalaras. You can give Shokarishta. You can give to the patient, and Stiplon tablet works very good. If the patient is not interested to take the Ayurveda and want to go for the allopathy, you can ask the tranexamic acid, mefenamic acid, and along with the K-stat. Okay. And first increase her HB levels by adding the hematinic. Some hematinic you should add to her. Okay. Okay, Pushpanjali.
Ma'am, any treatment for this, ma'am? Anechoic cyst?
Yes, we'll do. But first go for the hypothyroidism.
And she is anemic also, ma'am.
Yes, that's why I told you to first correct her anemia. Add hematinic to her and first stop the bleeding. Check the thyroid. The cyst is a very small one, so nothing to worry about that. Okay.
Thank you so much.
Welcome.
Thank you, doctor, and thank you, ma'am. Moving on to the next person, ma'am. Dr. Sanjay Tiwari, you can unmute yourself. Dr. Sanjay Tiwari.
Okay, madam. Thank you. Thank you. Good evening, madam.
Good evening. Good evening.
मैडम एक मेल चाइल्ड का अगर हमें रहेगा मराठी बोलू चालेल का?
Pardon? I didn't get you.
Can I talk in Marathi?
हाँ, sure, sir. You can.
Okay.
बोला तुम्ही.
मॅडम जसं मुलगा हवा असेल त्याच्यासाठी म्हणे आपण आपलं शास्त्रात वर्णन केलेलं आहे तर त्याचा कसा विचार करायला हवा?
Actually, this whatever you are asking about the Pumsavan.
Yes, Pumsavan.
ते actually the Pumsavan.
आता अभी हिंदी या इंग्लिश चलेगा मैडम, बाकी सबको भी समझे ना?
Pumsavan was told to get the Ichita Vanchita Santati, either girl child or the boy child. That is Ichita Vanchita Santati, means which we want. We can try that. But according to our Ayurveda, it is told that before the 8 weeks, that's before the differentiation of the sex, we can use this Pumsavana. If we'll give the Pumsavana, we can change the text according to the Ayurveda. But if we'll come to the practical, it doesn't happen because already it's a decided.
Okay. Good. Okay. मॅडम एक दुसरं विचार उत्तर बस्तीचा आपण क्वांटिटी किती द्यायचं? 5 ml की किती? 5
ml. I regularly give 5 ml.
Okay. आणि क्षार तेलाचं पण 5 ml ना?
क्षार तेला I used to give 3 to 4 ml only. But in cases of where the bilateral tubal blockage is there, in such a cases and with a good endometrium, thickness of the endometrium is good. In such a cases, I used to do the 5 ml because continuous administration of the Ksharatela may lead to the deficiency, means insufficient endometrial growth. So wherever the endometrium is sufficient and a much good thickness is there, in such a cases, I used to give the 5 ml, and wherever I will suspect the endometrium is a little bit less. So in such a cases, 3 ml, 3 to 4 ml.
Okay. And how many days we give?
Actually, 5 days. Okay, 5 days. Among the 5 days, first day I'll give the Anuvasana Vasti. Second day I'll give the Kashaya Vasti. Later, next 3 days I'll give the Uttar Vasti.
Okay. From period of which 6th day?
After stoppage of the bleeding, by the next day I'll start.
Okay, madam. Okay. And ma'am, one more question. Stana Granthi.
Yeah, I didn't focus on it because the slides are many, so I didn't.
Yes, that is a Stana Granthi. What should I do? Which
Fibroadenoma. Fibroadenoma can be correlated with the Stana Grandhi if the patient is having the symptoms such as a premenstrual breast tenderness, mastalgia, and intermittent pain in between the cycles and heaviness of the breast, etc. She's comparing. Then you can use the Kanchanara Gugulu along with the Punarnavadi Mandur to relieve the edema and to sensitize it and to soften it. You can use and Varunadi Kashaya. These 3 helps very good, and the strips are available as a Ravike strips prepared by our company, which are very good and which prepared the plasters. They have prepared the plasters having the Leucorrhoea drugs powder is coated on that, and they are applied for the whole day. So that is giving a very good result. Actually, I would have shared,
madam,
but
pardon,
the Ravicase strips. Ravicase strips. The name is Ravicase strips.
Spelling?
RAVICARE. Ravicase strips, and they are showing very good. Actually, I have those slides also, but so many slides were already there. So I removed those slides of the breast disorders. Fibroadenomas and fibroadenosis cases also we can treat with Ayurveda and having a very good results also here. Okay. Any more?
Thank you. Thank you, ma'am, and thank you, doctor.
Welcome.
Thank you for patiently answering questions, ma'am. Shall we move on to the next person, ma'am?
Sure.
Yes, ma'am. Next person is Dr. Shravan Shival. You can unmute yourself. Dr. Shravan, are you there? You may unmute yourself, Dr. Shravan.
Hello. Hello.
Hello.
Am I audible?
Yes,
Hello?
sir. Yes, Dr. Shravan.
Good evening, ma'am.
Good evening.
I am Dr. Sadhna Shivale.
Yes.
शतपुष्पा के बारे में पूछना था. शतपुष्पा सिद्ध ऑयल आपने बताया पीसीओडी में. तो यहाँ शतपुष्पा मीन्स शतावरी और शतावा मीन्स
शतावा anathema sova. Anathema sova.
Okay, thank you.
Okay. And it helps in clearing the PCO.
और उसका जो बस्ती देना है तो वो भी रेगुलर बस्ती उत्तर बस्ती मतलब अनुवासन उत्तर बस्ती दोनों में यूज करना है वो ना?
नहीं शतपुष्पा तैल I didn't use for the उत्तर बस्ती. I have used it for the nasya.
Okay, only nasya.
Only nasya. And the shatapushpa kashaya I use for the primary dysmenorrhea conditions and in PCO conditions where the delayed cycles are there. Shatapushpa helps in not only clearing the PCO but in getting the cycle in time.
कश्यप संहिता में मैम उसका रेफरेंस है पुष्प
जी कश्यप संहिता में है and at the same time and Shatavadi Taila which was explained in the Ashtanga Hrudaya also it is present to in the delayed labor. Okay. So it promotes the discharge. So the expulsion it promotes. So for the Arthava expulsion it helps. That is the condition. And it's a practical experience that whenever the Shatapushpa Kashaya is advised to the patient was in return telling that she is having the mild dysmenorrhea in such cycle and ask her to take the Shatapushpa, prepare a Kashaya and take it before the 5 days of the menstrual cycle.
Okay.
Okay.
Thank you, ma'am. और एक क्वेश्चन था आपने जो पत्रांगासा और गर्भधारण वटी बताया तो उसके कंटेंट्स या फिर आप बताए तो भी चलेगा.
Garbhadharan vati is a preparation of Dhanvantari forma and it contains some Rasaushadhis and Prajasthapana drugs in that, so it helps. You can see it on the online also, no problem. Even the Gondal pharmacies are having the Garbhadharak yoga. That also you can see on the online its contents.
Okay, madam. Patrangasa will be proprietary medicine in any company.
Patrangasa is prepared by almost all. It's a classical medicine. It is a natural uterine tonic. It strengthens the uterus and relieves the uterine infections and bulky uterus and edematous conditions of the uterus. To relieve them, the Patrangasa helps. You can find it in the classical text also.
Okay, ma'am. Thank you.
Okay.
आपने जो अंडाशय ग्रंथि हरयोग बताया तो उसका मीनिंग ऐसा लेना है कि पॉलीसिस्टिक ओवरी में सिस्ट ज्यादा होता है कोई
नहीं पॉलीसिस्टिक is a lifestyle but especially whenever the size of the cyst is more than 2 centimeters. I'm using the Andashaya Grandhi Harachuna as I told you already that drugs or Shotahara drugs of the Shonaka, Bilva and Agnimanda, and Lekaniya of the Mustaharidra, Daruharidra, and Pipali Mula. These are the drugs commonly I used, made into a powder form, taken in the equal quantity and given to the patient with a warm water, showing the very good result. So what the name should be placed, as it is used in the cystic condition. So that's why I named it as Andashaya Grandhi Hara Churna. So, but it is giving a very good result. So you can also try, as I told you, the ingredients, what I'm using. You can try.
Thank you, ma'am. Thanks a lot.
Okay.
Thank you, ma'am, and thank you, doctor. Shall we move on to the next question, ma'am?
Sure.
Yes. Dr. Kimia Dahipal, you can unmute yourself.
Okay.
Dr. Kimia.
Thank you, ma'am, for the very nice session. It was a really very nice session.
Thank you.
Presentation was very nice. I wanted to ask about the Kesharadi Kashai you have mentioned, like contents like what?
Kesaradi is nothing but the Stambhaka drugs which are you explained by Charka in the Adhyaya. Those drugs I have used. Available Stambhaka Aushadhi are prepared in the powder form and given to the patient.
Okay.
Because one thing I want to clarify you that my husband, Dr. Sridhar Anishetty, is a graduate and post-graduation in the Dravya Guna. So normally the 50 kashayas which are told by the Charka, we regularly use in the practice because he has a much grip over it. Whenever I ask regarding this drug, that drug, he explains me very well, and I will choose among the 10 drugs he has given in each Gana. From that I pick up the drugs which are very convenient to me and which are very easily available to me, and I'll give to the patient. Luckily, till today the good result is there. Next.
Yeah, it is good results. And I wanted to ask that Mahanarayan tail, what are the like specific indications where we can use it?
Where the much edematic condition and the patient complains of the severe pain. In such a condition, if you will give the Mahanarayana Taila along with the Dhanvantaram Tailam or the Sahacharada Tailam, the pain is relieved much and the symptomatic relief is achieved within the 1 cycle of Vasti.
Okay, it's a 60 ml of Matra Basti. Like 30 ml?
Yes,
120 ml.
60 ml, 30. When
30,
2
30.
oils are used to 30 ml. Okay.
Okay, fine.
Okay.
Thank you.
Welcome.
Thank
you.
Thank you, ma'am, and thank you, doctor. Shall we move on to the next question, ma'am? Is that okay, ma'am?
Okay.
Okay, ma'am. Dr. Ruchi Chaturvedi, you can unmute yourself. Dr. Ruchi Chaturvedi, are you there?
Yes, ma'am. Very good evening, ma'am.
Good evening.
My question is that a patient is suffering recurrent leucorrhea.
Okay.
So what would be the reason for that?
What is the age of the patient?
21.
21 years.
Yes. Unmarried girl means she is not married.
Ask her about the lifestyle and is there any usage of common toilets or unsterile articles usage, etc.
Actually, I asked her, she's not using any articles or something, and the toilets are also, I think, hygienic only.
Okay.
Means I'm unable to find the reason for that cause of this leucorrhea again and again. So it's difficult for the treatment.
So you can't, as she's unmarried, you can't do the PVI and PS also. Okay. So ask her what type of discharge is there.
Curdy discharge, ma'am.
Curdy discharge means a candid. So give her Krimihara drug along with the Shotahara drugs, and anti-inflammatory drugs should be given to her, and ask her, as itching is there, so ask her to prepare the Karvira Kashaya herself and wash herself.
Washing is with what kashaya?
Karavira Kashaya. It relieves the itching. It's the best kapha shamak and anti-inflammatory and as well as a Krimigna drug. So it relieves the itching immediately and discharge also immediately. Ask her to wash herself. And the anti-inflammatory drugs you add to her, and ask her to take continuously the Lodrasava for 1 month. Definitely she will have the good result. And as I think already you have given the fluconazole of 150 mg weekly once.
Yes, ma'am, given so much because she's coming again and again for the same problem.
So once ask her to go for the torch test.
Okay.
Means a decreased defense mechanism of the vagina because of any other infections. We'll find out and we'll treat.
With his Leucorrhea, she's having UTI also again and again.
Yes.
UTI problem, then Leucorrhea, then maybe
yes,
because
this is only a common thing. No? Whenever the vaginitis happens, it may ascend to the upper opening, that is the urethral orifice, and continuous. And again, that may spread downwards and again cause the vaginitis. So better to ask her to go for the cleaning, wash with the Karavira Kashaya and anti-inflammatory drugs. You add Kanchanara Gugulu and ask her first boost her immunity with anything, means immunomodulators, any drug you can give, boost her immunity, and ask her to go for the torch test once and find out is there any virus which is already decreasing her vaginal defense mechanism, and again recurrence of this candidiasis is seen.
Okay, ma'am. And ma'am, this Karavira Kashaya washing should be done regularly?
Regularly for 1 week. Ask her to go for it. Definitely she will give you the positive feedback.
Okay, ma'am. And what you told about that taking something orally for 1 month?
Pardon?
You told na taking something.
Lodrasava.
Okay.
Thank you, ma'am, and thank you, doctor. Ma'am, if your time permits, we can move to the next person, ma'am.
Next 5 minutes.
Okay, ma'am. Sure, ma'am.
Okay.
Sure, ma'am. Dr. Savita, you can unmute yourself. Dr. Savita, are you there? Dr. Savita, you can unmute yourself. I think she's not there. Yes.
Am I audible? Hello?
Yes, ma'am. You're audible, ma'am.
Very good evening, ma'am.
Good evening.
I just want to ask, what can we do for Asherman syndrome? No history of TB, ma'am.
We can't do. Just you can try the Balataila Uttarvasti so that improvement in the endometrium may happen. Already she has taken, I think, hormones, etc. She has taken, I think so. The patient has no. So then you can cycle inducing drugs you can use, and if she's a married one, go for the Uttarvasti.
Yes, ma'am. She's very married and want to conceive also.
Yes. Ovaries, what about?
Uttarvasti with which Stella, ma'am?
101 Avartita Balataila. First cycle with the Kshira Balataila, then you go for the 101 Avartita Balataila. It definitely helps in the Asherman syndrome. Okay, but what about her ovaries?
Normal, ma'am.
Normal. Okay. You can try.
Okay, ma'am. One more question, ma'am. If there is metrorrhagia with endometrial hyperplasia, yes, then we should first stop bleeding and then Lekhan.
Yes. First we should stop the bleeding. Then we should give the Lekana.
Okay. Thank you.
But meanwhile, we have to check her HB levels and thyroid also, and then we should treat them simultaneously.
Yes, ma'am. Yes, ma'am. Up to what size the ovarian cyst we can treat, ma'am?
If it is a simple cyst, up to 7 to 8 centimeters also we can try.
And if it is
complex, if it is a complex cyst, up to 6 centimeters. Okay, after that, we can't, because as the size increases, automatically the symptoms also increases much, okay, and the patient will not.
Okay. Thank you, ma'am. Very nice session, ma'am.
Pardon?
Thank you, ma'am, and thank you, doctor. Moving on to the next person, ma'am. Dr. Dhananjay Jaiswal, you can unmute yourself. Dr. Dhananjay.
Good evening, ma'am.
Good evening. Good evening.
Ma'am, first of all, I would like to thank you for this wonderful presentation. You made really a great effort. Thank you so much, ma'am.
Thank you.
Ma'am, I have a question that is modality of treatment for gynecological disorders vary according to Prakriti of patients and how to approach according to Prakriti?
Of course, sure. Because in a women with the Pitta Prakriti, in a women who is having a Pitta Prakriti, there are the more chances of having the Rakta Pradara cases, menorrhagia, metrorrhagia cases. When she receives the Vatakar, Pittakar, Ahara, the formation of the abnormalities, abnormal growths in the uterus is suspected. This is the phenomena. So depending upon the cases, means for example, if an infertility case is there, first either whatever may be the prakriti, the psychological counseling plays very important role. In most of the infertility cases, what happens, there is no any pathology, no pathological condition is seen, but the patient is not getting conceived. With that, she may go into the depression, as you all know, the chinta vata pravartana. So as she goes into the depression, the vata prakopa happens, though she belongs to any prakriti, but the vata should be treated first, isn't it? Hello, Jaiswal sir, are you there?
Dr. Jaiswal, are you there?
He left.
I think he left, ma'am.
Okay.
Thank you, ma'am, and thank you, doctor. There's this last question, ma'am. Question from YouTube session, ma'am.
Sure.
Yes, ma'am. Please advise treatment for anovulation in infertility patient. No history of thyroid or diabetes mellitus or hypertension.
Okay. So if it is an ovulatory cycle, she want to get conceived, as usually you will induce the ovulation with the clomiphene citrate. With the clomiphene citrate also, if she is not having the further injections, etc. are available. If she is not interested to go for that, you can start the Apankala Chandra Prabhavati at the 10th day of the cycle, and you can see that the ovulation will happen on the 16th or 17th day. You will find the ovulation along with the Dashamularishta, Garbhadarnivati, and ovarian tablets which are available, which is the Ayurvedic preparation, and results are very good. And Apankal Chandra Prabhavati, when given on the 10th day in the cycle, definitely it will ovulate. With the clomiphene citrate also, where the ovulation is not happened in cases of infertility, it's observation, it's a personal observation. I have experienced that with the Apankal Chandra Prabhavati, Dashamularishta, and first 15 days with the Allos compound ovarian tablet, the ovulation has happened. Hello.
Okay, ma'am. Thank you, ma'am. Shall we wind up the session, ma'am?
Sure.
Sure, ma'am. Thank you very much, ma'am. It was really informative session for a clinical practice. And thank you so much for answering all the questions with patience, taking your own time, ma'am. Thank you all participants for listening and coming up with lots of questions. Sorry, we were not able to clear all the questions. Thank you everyone. To know more about our updates, please do stay connected with our social media platforms. There is always light if only we are brave enough to see it. And if only we are brave enough to be it. So let's be brave delegates. That's all for today's most interesting session with lots of new information for us to close our eyes. Thank you all for joining us, and thank you. Thank you, ma'am. Good night, ma'am.
Thank you, Jinsi. Dr. Jinsi, thank you.
Thank you, ma'am.
Okay, I'll leave. Okay.
Yes, ma'am.